This is a presentation on the City of Largo by Diane Tierney and Heather Morris. Largo has aptly been nicknamed the City of Progress, and it provides much opportunity to the members of its community. Largo became an official town in 1905 with the adoption of a town manager form of government in 1913. Due to its central location, Largo was a major stop along the Orange Belt Railroad, with economic endeavors in orange groves, cattle, and vegetables. The Great Depression and a major freeze in the 1920s led to uncertainty and a decrease in town borders. However, following World War II, the population boomed from 1,500 residents to 5,300 due to attractions such as year-round sunny weather and close access to beach activities. Although agricultural activities continued to decline due to increased difficulties such as a major freeze in 1962, Largo continued to draw housing and business developers. Today, Largo is home to 77,648 residents and continues to grow with progressive city development projects underway. Largo provides its community with many resources that promote safety, health, and a fine standard of living for the middle class. Largo provides loans at low interest rates to families interested in improving the structure and quality of their owned home. There is a multitude of recreational facilities, a cultural arts center, and city prioritization of police force and fire department. There's also a variety of shopping and healthcare resources. Comparing rates of employment and number of residents living in poverty, Largo does better than the average of Pinellas County. In Pinellas, the rate of unemployment is 2.5%, while in Largo, the rate is slightly improved at 2.1%. The percentage of families living below the poverty level in Pinellas County is 6.7%, while in Largo, the percentage is only 6%. However, one also notes that the racial diversity of Largo is decreased as compared to Pinellas County. A major example is the consideration of African Americans, with 10.3% residing in Pinellas County, but only a total of 5.6% in Largo. As a result, one wonders about the resources that are available to those living in poverty and of diverse backgrounds.
When we collected data, the only population issues that came up were the lack of seasonal fluctuations for the city. Through observations, it is obvious in the winter months that the population increases as well for summer vacations and spring break. Per the U.S. Census of 2010, the majority of the population is Caucasian, with only 5% having a master's degree. The majority of the city, at 88%, have a high school diploma or higher. The health issues that are a concern in Largo are STDs, cancer, and heart disease. STD education in Florida schools is happening, but many are unsure of what topics are covered because there is no definitive curriculum. The time spent on the topics is unknown as well, along with how many kids actually attend and if the parents even opted them in to attend. All of this has contributed to the increased rise in STDs in Florida. The need here would be to initiate a program such as the Safer Choices program initiated in the early 90s as a study in Texas and California. This is a 2-year high school program that showed increase in knowledge about the diseases and risks, changed attitudes about protection, and increased the communication between the kids and the parents. In the community, alcohol use, tobacco use, sedentary lifestyles, and poor diet choices all play a role in the risk factors for cancer and heart disease. It has been proven through the literature and studies that these risk factors solely or in combination contribute to hypertension, strokes, and lead to an increased risk for cancer. The possible health needs for the population of Largo may be increasing screenings for blood pressure and stroke risks. They may also need increased awareness regarding the programs available for screening and routine follow-ups. This also includes being able to choose healthy foods and incorporate an active lifestyle. The healthcare system can be useful in having early detection programs and improving healthcare delivery by obtaining detailed family histories in order to better care for the patient and their conditions.
Largo provides a variety of high-quality resources. Largo Medical Center has 2 central locations that provide affordable resources and never turn residents away, no matter how full the hospital is. Other health-related resources include walk-in clinics, urgent care clinics, a community health center, hospice and skilled nursing, and there is also limited resources at the Pinellas County Health Department. Ensure residents can easily access quality health resources. There are few community clinics that offer services for the uninsured. Research reveals that the Largo's Public Health Department only provides WIC resources, and impoverished families must travel to Clearwater or St. Petersburg to obtain other health supportive resources. There is also an absence of resources for the homeless, such as shelters or food pantries. As a result, impoverished and vulnerable diverse populations have a more difficult time to find publicly funded or reduced cost resources. Review of Largo Community finds 3 community objectives based upon the recommendations of Healthy People 2020. First, Largo must focus on reducing healthcare disparities for the impoverished and other diverse groups. Although Largo doesn't have a decreased amount of both these groups, community assessment reveals that resources for these groups are scant and require travel to other cities for access to a greater amount of resources. Upon review of vital statistics in Pinellas County, cancer is revealed as the #1 cause of death. Focus on initiatives to reduce cancer include early screening and detection, access to treatment options, and education on preventable risks such as smoking, UV damage, and disease management. Sexually transmitted diseases become the 3rd objective due to being the #1 disease in Pinellas County. Interventions may be education of safe sex practices, early disease detection, and effective treatment.
The parks and recreation areas for the community are welcoming to any visitor. They are family-friendly with ease of access, availability, and affordability. Many of the resources are close by with the beaches and golf courses near, including the Largo Library. The library has many activities for all ages, including English and signing classes, children's reading time, and computer groups. The Largo Police service the Largo area, and there are 4 fire stations in the area, including Station 38, 39, 41, and 42, with 38 being the only one equipped with hazmat gear. The concerns for Largo came from the Windshield Survey 2016 regarding many things in the community. These concerns are composed of how long the road work is taking with the constant changing of traffic patterns making driving very dangerous. There is a lack of bike lanes, and most of the people seen lack the proper lighting, clothing, and are not wearing helmets. A lot of pedestrians are also seen joyriding or walking and not utilizing the sidewalk, as well as not riding in the correct direction. Another concern is the high access to fast food on almost every corner, with healthier choices few and far between. The idea would be to offer healthier choices at the fast food chains to make it easier on the consumer to make better choices and to promote better health.
Largo has a city manager form of government, where the mayor, Woody Brown, makes decisions in conjunction with 6 city commissioners. Legislative decisions are made at monthly commission meetings. Largo tries hard to include residents in this decision-making. Residents can request 3 minutes to speak to the commission at the beginning of the meeting. In addition, Largo conducts annual resident surveys to gain insight on community values. Largo has been awarded for its excellence in budget planning, and it is apparent that it is guided by the needs and desires of the community. In 2015, residents mainly wanted a community that is safe and environmentally pleasant. In review of the budget, one finds that the police department, fire department, and environmental services are given priority. The main area of concern found is that not all residents are represented by the community surveys. It is the most active residents who have responded to the surveys. Those who are diverse, impoverished, or disabled may have difficulty conveying their needs to the Largo government. One suggestion may be a government outreach survey to areas of concern, such as a concentrated low-income area.
The community needs are in order of importance based on the community issues at hand, including STDs and main causes of death. This is first due to the rise of STDs in the community and the unknown amount of education in the schools given. The second is related to the main causes of death, including heart disease and cancer, each being linked to unhealthy lifestyles and food choices. In addition, because of the impoverished, the healthy food may be inaccessible or unaffordable, leading to health risks and diseases as well as access to health care. The homeless is in the middle because access to mental health care can be difficult and the funding comes from many sources as well as it not being a priority in the health field. The last two concerns are regarding road work and road safety. The road work and constant traffic pattern changes poses a risk for drivers on the road, pedestrians, and bike riders. Bike riders, per the Windshield Survey 2016, are not wearing safety gear, lights, or helmets. The rising of STDs in the community is one of the primary health issues in the city of Largo. In the Brazilian National Health System, they provide access across the country for diagnostic testing and free patient care, as well as free drug treatment for HIV. They also offer free condoms and free harm reduction kits for overdoses. Lastly, they give results of the testing in many communication forms such as email, social networking, text messages, and calling the patient. In Largo, the Pinellas County Health Department provides STD clinics and treatments at 5 health department locations, including free HIV test sites in the county. Some sites are in Largo, including the Green Chapel AME Church that accommodates English and Spanish-speaking patients, but the site is only open from 9 to 3 a few days of the week. Some of the sites only speak English and do not test for both STDs and HIV. It is usually just one or the other. Also, the cost of the services range from the site using a sliding scale to a fee of $15 for the service provided. Lastly, Pinellas County offers an ADAP program, the AIDS Drug Assistance Program, that will offer help with treatment and drugs. It is limited to 49 treatment drugs and there is a criteria that needs to be met prior to acceptance to the program. These requirements include proof of HIV, proof of living in Florida, denied Medicaid, and an income of less than 400% federal poverty level. The community nurse can advocate for a curriculum for sex education to be made with the tracking of students and test for knowledge and application. The nurse can also speak with the health departments and the mayor regarding the need for free services and more services made available at other sites for treatment.